So it's interesting. I'm sure you have many stories of things that are challenging, specifically as a woman leader. One of the things that I find particularly challenging is it's really easy for me or natural for me to compliment someone and encourage them and help them grow. What I have a really hard time with is finding a delicate way to give someone negative feedback or try to encourage people to do better or work harder or just be better in whatever way the context is about. So I'm curious how you balance that as a woman, because I think it's different than how you balance that as a male leader in a practice.
You're right, and I didn't have a blueprint that I could follow on how to do that. So I think part of it is being human and just saying, how can I best relate to this situation? And often I'd say we. How can we solve this? And then kind of get feedback. And this way I said, well, you did something wrong and it's all your fault. I never blame the person. I always try to say, this is a situation. How can we do better the next time so we don't have that happen again? And that's how I would start a conversation, but in a very calm note, never raising my voice, never using bad language, and it would be in a private room with the door closed so that that person had the confidence that it was a safe space.
I love that. That's great. Thank you.
And I just want to make one more point to that, which is that is actually a great negotiating tactic for women. If you read a lot of different books, like, for example, Lean In, Machiavelli for Women, which is an interesting book title, but has some great negotiating tactics, positioning yourself as part of the team, as a female leader, tends to bring you more success. So I think that's a great point. But I also want to talk about something that you mentioned earlier, which is prioritizing your purchases. So when you had your one room, what did you worry about buying the most? And did you finance the equipment? Did you buy it? What was the most important thing that you had to buy first? How did you do that?
Obviously, I need a slit lamp.
Yeah, fair enough.
That was a definite, and I needed a chair for the patient and one for me, so that was like a given. But then, where do you go next? And there are so many diagnostic tools that we have right now, and each one does something unique and different, and ideally we may want them all or many of them. So again, this is where Business 101 comes in. What is your business plan? What is the return on investment for that product? And I didn't know how to calculate that initially, so I sat down with my industry partners and said, how many patients would I have to see and do the pace at which I'm doing? I don't want to do more because I don't want to feel like I have to do more in order to pay for it. I don't want to feel that pressure to pay this off. And then when is the next version coming out? Am I buying something where in 6 months version 2 or version 3.0 is coming out? Then maybe I'll wait. So you have to look at how can you integrate it into your practice? Do you have that patient base? Are you bringing a whole new service into the business? And do you have the patients, or do you have to go out and market? And how much is the marketing campaign going to cost? So I would say start conservatively. Whatever patient base you have, start with products or diagnostic tools focused on delivering a better outcome surgically, maybe a new OCT or a new IOL biometer or something like that to deliver better outcome. And then that in itself will hopefully generate more income to buy more products.
You touched on something that I think is really interesting, which is not feeling pressured to do more, but at the same time trying to advance your practice and trying to grow your skills. So I'm curious, was there a tipping point or a natural growth in your own practice where you felt you had to maybe balance the desire to stay small with the desire to grow, and what challenges did you face as you were growing?
And that is hard. The larger you get, the harder it is to maintain your brand, your philosophy, and the way you want every patient treated. So we always emphasized a patient-centric practice. That was our motto. And the weekly 1-hour meetings led by me made a big difference because everybody kind of always got back on the same page. But that took time, and that was a cost to the practice because we would stop seeing patients for that hour and not generate income. But it paid back in bundles.
Yes.
So it's doing all of those things and always staying in touch with each of the physician providers as well. So that I would have a one-on-one meeting with them at regular intervals so we could stay on the same pace as well, because then they could carry that philosophy when they were seeing patients and delivering patient care.
I also think one thing that's kind of a departure from training to the business of ophthalmology is the idea that it's not just about you as the physician anymore. So when you're in your training, you're trying to improve your skills, but really it's about the patient experience. So I think that's a great point of having those 1-hour meetings, because no matter how great you are, you're only as good as the people around you.
Or the way they perceive.
Or yes, exactly.
Yes, because perception is
It's all
reality.
about perception.
Yes, exactly. And that's where analytics come in. We relied a lot on analytics. We queried our patients, we queried our staff. We did all this so that I had concrete data of how many satisfied customers we had, patients, unhappy patients, and how to deal with the unhappy patients. And we had a whole protocol of how to address negative comments on our website. So we had every duck covered.
How did you develop all of those things?
One by one. Yes. And as a situation came up, I figured, okay, let's come up with a solution like we talked about earlier. And now this becomes our kind of way to do it till we figure out a better way.
Right.
Yeah. Oh, that's wonderful. Such great pearls. I love it. We touched on this a little bit earlier, but I think it is worth asking specifically, what are some unique challenges that female surgeons and female business owners specifically face today compared to your earlier years?
Thank goodness we've made so much progress.
Thank you for all of that. Yes.
From when I started, the world has changed. About 50%, if not more, of ophthalmologists are women now. We have women in leadership positions within pharma and within healthcare systems. We have role models. We have mentorship programs. So it's nothing like the dark ages when I started. But there are still challenges, and some of it is something so basic as a surgical chair. Many of them are designed for men, male surgeons, and now some companies have actually designed a female surgeon's eye chair so that we can sit more comfortably. The range is different because our body types are typically smaller than those of men. So little things like that can go a long way.
That's wonderful.
I said it should be Pepto-Bismol pink.
It should be.
I agree.
So tell us a little bit about what you're doing now and what's going on in your phase 2 of your career.
Well, phase 2, again, I would not have imagined this if you had asked me this question, Neda and Emily, 20 years ago or 25 years ago. But right now, I'm thrilled and using completely different skill sets than what I was doing in the OR or doing interventional dry eye treatments. I'm the chief medical officer of 2 startup pharma companies. I'm the chief medical advisor for another healthcare company. And I started 2 separate companies. One is a group purchasing organization for ophthalmology. We didn't have one. Optometrists have had it. It's a very matured system because they had stuff to sell, like spectacles and contacts, but I started one for ophthalmology. And then lastly, I started the American College of Eye Technicians. It's a recruitment company that's not non-for-profit, not profit, where we recruit from less optimal socioeconomic backgrounds and neighborhoods to bring them into the field of ophthalmology and help them start a career in our field.
That's amazing.
Thank you so much. You are really such an inspiration to us both, and I'm sure everybody watching. So we've really so appreciated learning from the challenges that you've overcome and the new opportunities that you're having now.
Thank you so much, Neda and Emily.